Welcome back to another Deep Dive Med. Today we're taking a deep dive into the world of allergies and asthma. But we're not just talking about the sneezing and the wheezing. We're going to go deeper than that.
Yeah.
We're going to look at what's happening inside the body and really get a grasp on all the complex mechanisms involved.
Yeah, it's fascinating stuff.
Yeah.
We'll be drawing a lot of information from a pharmacology lecture about respiratory diseases. And I think you'll be surprised by some of the details of how these conditions actually work and how the medications that we use are able to treat them.
Okay, so let's start with the immune system.
Okay.
We all know, the immune system is our body's defense system.
Right.
It's like our internal army protecting us from those nasty invaders. But sometimes it seems like it overreacts a little bit. Like, it sees a harmless peanut as a deadly threat and launches a full-scale attack.
Yeah, exactly. With allergies and asthma, that's kind of what happens. The immune response goes a little bit haywire, and these normally harmless substances like pollen or dust mites or whatever it is you're allergic to, they become these allergens that trigger this inappropriate and often excessive reaction.
Right, those common culprits. But the lecture also mentioned something I hadn't thought about before, sulfites. Apparently, they can lurk in foods and even medications and cause some unexpected reactions.
Oh, yeah, for sure. They can be sneaky.
It really makes you think, what else could we be encountering every day without even realizing it?
Right. That's a good point. And speaking of things we might not realize, let's talk about IgE, or immunoglobulin E. These antibodies are kind of like these little tiny time bombs attached to mast cells in our tissues.
Time bombs.
Oh.
All right, now you've got my attention.
Yeah.
What exactly happens when these IgE bombs go off?
Well, imagine mast cells as like little water balloons filled with inflammatory chemicals, just waiting to burst.
Yeah.
When you encounter an allergen, it triggers those mast cells to degranulate, and they release a flood of these chemicals, including histamine.
So that's what's happening when I suddenly start sneezing uncontrollably. It's like these little water balloons bursting all over my nasal passages.
Exactly. That histamine release is responsible for all of those immediate allergy symptoms.
Okay.
The wheezing, the runny nose, itchy eyes, all of that. It's what we call the early phase response.
So what about this late phase response that the lecture mentioned? What happens during that delayed reaction?
Well, that's where things get a little more interesting. The initial histamine release that we talked about is really just the beginning. It actually sets off this chain reaction called the arachidonic acid cascade.
Arachidonic acid cascade. That sounds pretty intense.
It is. It's kind of like a waterfall where one chemical reaction leads to the next. It starts with an enzyme that breaks down the mast cell membrane, releasing arachidonic acid. And this sets off two main pathways that ultimately lead to the production of these compounds called leukotrienes and prostaglandins.
Leukotrienes and prostaglandins. I've heard those names before, but I don't really understand what they do.
Yeah, so these are the compounds that are responsible for the prolonged inflammation and all those lingering allergy symptoms that can last for hours or even days after that initial exposure.
Oh, wow.
So sometimes when those allergies just seem to drag on, it's the leukotrienes that are really the culprits.
I had no idea those lingering symptoms had their own name and pathway. So is there anything we can do to stop this arachidonic acid waterfall?
Thankfully, yes. There are medications that can help, and inhaled corticosteroids are considered the most effective way to manage this cascade and the resulting inflammation.
So those are those prescription inhalers, right?
Yeah.
I know a lot of people with asthma use those.
Exactly.
Like Flovent.
Yep. Those are common ones. Asthmatic Pulmicort, there's a number of them. And you might even be using one yourself. But here's something interesting. It's really important to know both the brand name and the generic name of the medication you're taking.
Why is that? Don't they do essentially the same thing?
They do, but here's the thing. A lot of times, patients describe their inhalers by color.
Really?
Yeah. Like they'll say, oh, I use the purple one, which might be Advair, for instance. But if you're talking to your doctor or your pharmacist, it's really important to use the generic name so there's no confusion and you're getting the right medication.
That's a great point. I never thought about it that way. It's like knowing the official name versus the nickname.
Yeah.
Right?
Yeah.
It's good to be specific when it comes to medications, especially those affecting your breathing.
Absolutely. Now, speaking of medications and their effects, let's talk about another group of chemical mediators involved in airway function, and that's prostaglandins.
Prostaglandins.
Oh.
Okay, I've heard that term before, but remind me what they do.
So they actually play a bit of a dual role when it comes to our airways. Some prostaglandins can cause them to constrict, meaning the airways narrow, while others can actually cause them to dilate or open up. It's really all about balance.
A dual role. That sounds a little tricky. Could this be why some people with asthma have trouble with everyday medications like ibuprofen or aspirin?
You're exactly right. Those medications are NSAIDs, and they can actually inhibit prostaglandin synthesis. So in some people with asthma, taking those medications might tip the scales towards bronchoconstriction and cause breathing difficulties.
Wow, that's a really important connection that I wasn't aware of. Have you ever noticed your asthma getting worse after taking ibuprofen? This could be why.
Yeah, it's definitely something to be aware of.
It really highlights how important it is to talk to your doctor about all the medications you're taking, even the over-the-counter ones.
Absolutely. Open communication with your healthcare provider is key.
For sure. Now let's move on to another class of medications that I know can be used for asthma, and these are leukotriene modifiers.
Okay.
So these are targeting those leukotrienes we talked about earlier, the ones responsible for those long-lasting allergy symptoms.
Exactly. They work by blocking the action of leukotrienes and essentially stopping them from causing inflammation and all of those pesky symptoms.
So it's like they're intercepting those troublemakers before they can do any damage.
Yeah.
What are some examples of these leukotriene modifiers?
One of the most well-known is montelukast. Goes by the brand name Singulair.
Singular. Okay. And are leukotriene modifiers typically the first line of defense for asthma?
They're generally considered an alternative to low-dose inhaled corticosteroids for people with mild persistent asthma, or they can be used in combination with other medications for a more comprehensive management approach.
Gotcha. So another tool in the toolbox for controlling those asthma symptoms. And like inhaled corticosteroids, they're more for long-term control, not immediate relief during an attack, right?
That's right. They work over time to reduce inflammation and prevent symptoms.
Makes sense.
Yeah.
Okay, so we've talked about leukotrienes, prostaglandins, and all these medications that target them, but we can't forget about histamine.
Right.
It's still a major player, especially when it comes to those annoying nasal allergies.
Oh, for sure.
Yeah.
Histamine is the main culprit behind that familiar runny nose, the itchy eyes, sneezing congestion, you name it. It's those mast cells releasing histamine in your nasal passages that cause all of that.
Okay, so what can we do about it? Are there medications that target histamine specifically for nasal allergies?
There are. For long-term control, intranasal corticosteroids are very effective. They work similarly to the inhaled corticosteroids, but they're formulated for delivery directly into those nasal passages.
So basically the same medications, but in a nasal spray form.
Exactly. Some popular examples that you might recognize are Flonase and Rhinocort. You might even recognize those names from the inhaled corticosteroid world because they often contain the same active ingredients, just in a different delivery system.
Huh. That's interesting. So it's important to pay attention to both the medication name and its form to avoid any confusion.
Definitely. Now, another option for nasal allergies is mast cell stabilizers.
Oh, right.
Remember cromolyn sodium?
Yeah.
So the intranasal form of cromolyn works the same way in the nose as it does in the lungs, preventing those mast cells from degranulating and releasing all that histamine.
Oh, so it kind of does double duty there.
It does.
That's pretty cool. And then, of course, we have to talk about the classic allergy medication, antihistamines.
Oh, yeah.
I remember the days of feeling super drowsy after taking those old-school antihistamines.
Right. The first-generation antihistamines like Benadryl are notorious for that sedating effect. But thankfully, we now have newer second-generation antihistamines like Claret and Zyrtec Allegra that offer relief without causing as much drowsiness.
Oh, that's a game changer. I'm sure a lot of people appreciate having options that don't leave them feeling sleepy.
Definitely. It's all about finding the right treatment that works for you and your lifestyle.
Wow, we've covered so much already. It's amazing how much is going on behind the scenes with something as seemingly simple as allergies.
It really is. And there's still so much more to explore.
I know. Can't believe we're just getting started.
In the next part, we're going to delve into the intricacies of airflow, airway resistance, and the role of the autonomic nervous system in breathing.
Okay, airflow and airway resistance. Those sound pretty fundamental. What do we need to know about those?
Well, think of it this way. Airflow is the movement of air in and out of your lungs. And airway resistance is basically how much those airways resist that flow. It's kind of like friction in a pipe.
Okay, that makes sense. So in conditions like asthma, where the airways are inflamed and constricted, that resistance increases and makes it harder to breathe.
Exactly. And a number of things can contribute to that increased airway resistance, including bronchospasm mucosal edema, which is basically swelling of the airway lining, mucus plugging, and even the physical properties of the air itself can play a role.
Wait, the properties of the air can affect our breathing.
They can be. Air density and viscosity play a role. Denser air, like cold air, is actually more resistant to flow. That's why some people experience more breathing difficulties in cold weather.
Hmm.
And thicker or stickier air, which is more viscous, also creates more resistance.
Huh. I never realized the air itself could make such a difference.
Yeah, it's all these little things that can have an impact. We'll dive into another crucial player in regulating airflow, and that's bronchial smooth muscle.
Bronchial smooth muscle. Is that the muscle that surrounds our airways?
It is. It's a layer of smooth muscle that encircles the bronchi and the bronchioles, and it's responsible for controlling the diameter of those airways.
So when that muscle contracts, the airways narrow, and when it relaxes, they open up.
Exactly. That dynamic regulation is essential for maintaining optimal airflow. But in conditions like asthma, that delicate balance can be disrupted.
I'm guessing that in asthma, this bronchial smooth muscle becomes kind of hyper-responsive, constricting more easily in response to things like allergens or irritants.
Exactly. That hyperresponsiveness is a hallmark of asthma, and it's a major contributor to those wheezing and shortness of breath episodes.
Man, this is getting complex.
It is.
It's amazing how much is going on behind the scenes with something as simple as breathing.
It really is. And we're just scratching the surface.
You were saying that our bronchial smooth muscle plays a big role in all of that.
Yeah, it does. It's kind of like the gatekeeper of our airways.
Okay, so it controls how much air can get in and out.
Exactly. And like any good gatekeeper, it needs instructions on when to open and close the gate, right? And that's where the autonomic nervous system comes in.
Okay, the autonomic nervous system. So that's the part of our nervous system that controls all those automatic functions we don't consciously think about, like breathing, heart rate, digestion.
Exactly. And it actually has two main branches that are involved in controlling our bronchial smooth muscle, the sympathetic nervous system and the parasympathetic nervous system. And they have kind of opposing effects. So you can think of it like a tug of war.
A tug of war.
Okay.
I like that analogy. So which side is trying to open the airways and which side is trying to close them?
Well, the sympathetic nervous system is the one that wants to open things up. It's associated with our fight or flight response. So when it's activated, it releases norepinephrine, which tells the bronchial smooth muscle to relax. And that allows more air to flow through.
So when I'm stressed or exercising, my sympathetic nervous system is actually helping me breathe more easily.
Exactly. It's your body's way of ensuring that you have enough oxygen to deal with whatever challenge you're facing.
That's pretty cool. So what about the other side of the tug of war?
Well, that's the parasympathetic nervous system. It's all about rest and digest, conserving energy, and promoting relaxation. So it releases acetylcholine, which actually tells the bronchial smooth muscle to contract, narrowing the airways.
So it's like a balancing act between these two systems. One wants to open and the other wants to close.
Exactly. But in asthma, this balance can be disrupted. And the parasympathetic nervous system can become a bit overzealous, leading to excessive airway constriction.
Ah, so that's where bronchodilators come in. They help to relax those muscles and open up the airways again.
You got it. And there are two main types. Beta-2 agonists, which essentially mimic the effects of the sympathetic nervous system, and anticholinergics, which actually block the effects of the parasympathetic nervous system.
So they're kind of working on opposite sides of that tug of war.
Exactly. And sometimes they're even used together for a more comprehensive bronchodilating effect.
Okay, it's like having a two-pronged approach to opening up those airways.
Yeah.
This is also fascinating. It's amazing how much is going on behind the scenes with something as simple as breathing.
It really is. And speaking of breathing, let's shift gears a bit and talk about lung volumes and capacities. These are measurements that can give us valuable insights into how well our lungs are actually functioning.
Okay, lung volumes and capacities.
Mm-hmm.
So we're talking about how much air our lungs can hold and how efficiently they're working.
Exactly. And there are specific terms for each of these measurements. For example, tidal volume is the amount of air that you breathe in and out during a normal relaxed breath.
Okay, so tidal volume is like my everyday breathing. What about when I take a really deep breath? Like before diving into a pool?
Well, that's using your inspiratory reserve volume. It's that extra amount of air you can inhale after taking a normal breath.
Ah, so it's like tapping into my reserve tank of air.
Exactly. And what about when you're blowing out all the candles on a birthday cake? That's your expiratory reserve volume at work. That extra amount of air you can forcefully exhale after a normal exhalation.
Okay, so we have tidal volume, inspiratory reserve volume, and expiratory reserve volume. Are there any other volumes I should know about?
Yes. There's one more called residual volume. And that's the amount of air that remains in your lungs even after you've exhaled as much as you possibly can.
Really?
It's kind of like a permanent air reserve that keeps your lungs from collapsing.
Huh. I never thought about that.
Mm-hmm.
Even when I think I've emptied my lungs completely, there's still some air hanging out in there.
There is, and these four volumes that we just talked about can be combined in various ways to give us what are called lung capacities, which give us a broader picture of lung function. For example, vital capacity is the total amount of air you can exhale after taking the deepest breath possible.
Okay, so it's like my lungs' full range of motion, from completely full to completely empty.
Exactly. And all of these volumes and capacities can actually be measured using a technique called spirometry, which involves breathing into a specialized device.
Spirometry, I've heard of that. Isn't that commonly used to diagnose and monitor lung conditions like asthma?
You're absolutely right. It's a very valuable tool for assessing lung function and tracking the progression of respiratory diseases.
So by measuring things like how much air I can exhale in 1 second, doctors can get a good idea of how well my lungs are working and how asthma might be affecting them.
Exactly. In fact, one of the key findings in asthma is a reduced FEV1, which stands for forced expiratory volume in 1 second.
Okay, FEV1. So it's basically measuring how quickly and forcefully I can empty my lungs. And in asthma, it's reduced because of that airway obstruction we were talking about earlier.
Exactly. And another important measurement is the FEV1-FVC ratio. The FVC, or forced vital capacity, is the total amount of air you can exhale after taking a deep breath. So this ratio basically compares how much air you can exhale in 1 second to the total amount you can exhale.
And I'm guessing that in asthma, this ratio is lower because the FEV1 is reduced more than the FVC.
Got it. That reduced ratio is a hallmark of obstructive lung diseases like asthma.
Wow. This spirometry test sounds pretty powerful.
Yeah.
It's amazing how much information you can get just from breathing into a machine.
It really is. And spirometry can also be used to assess the reversibility of airway obstruction, which is another key feature of asthma.
Reversibility, what does that mean?
Well, it means that the airway obstruction can sometimes be reversed with medication.
Okay.
So in asthma, the airways are hyperresponsive and constricted, but they can often be opened up with bronchodilators. So spirometry can be done before and after using a bronchodilator to see how much the airways improve.
So if my airways improve after the bronchodilator, that's a good indication that I have asthma.
It's one piece of the puzzle, along with your symptoms and your medical history, but it's definitely a key diagnostic factor.
This is all so incredibly fascinating. It's like we're peeling back the layers of the onion here and seeing all these intricate mechanisms at work.
It really is, and there are even more layers to explore. In the next part, we'll delve into the different types of asthma, those specific triggers you were asking about earlier, and how those influence the treatment approaches.
Okay, I'm already hooked. This is more complex than I ever realized.
You're absolutely right. Asthma is actually a whole spectrum of conditions, and understanding the different types can really help us figure out how to best manage them.
So let's break it down. What are some of the most common types of asthma?
Well, the most common one you'll probably hear about is allergic asthma. And as the name suggests, it's triggered by those allergens that we talked about before, things like pollen dust mites, pet dander mold.
So for someone with allergic asthma, their immune system basically goes into overdrive when it encounters those substances. And that leads to those classic asthma symptoms.
Exactly. Their airways are basically on high alert, ready to react to those specific triggers.
Okay, that makes sense. But what about people whose asthma isn't caused by allergies? What triggers their symptoms?
So that's where non-allergic asthma comes in. And this type can be triggered by a variety of things like respiratory infections, exercise, cold air, stress, even certain medications can trigger it.
So it's not an immune system overreaction in those cases.
Right.
It's more about the airways becoming irritated and inflamed due to these other factors.
Exactly. The underlying mechanisms might be a little different, but the end result is the same airway narrowing difficulty breathing those familiar asthma symptoms.
Wow, so there's a whole range of triggers to be aware of.
Yeah.
You mentioned exercise as a trigger, and I know some people have what's called exercise-induced asthma. Is that actually a separate type of asthma?
It's not technically asthma. It's actually a condition called exercise-induced bronchoconstriction. So it's basically a narrowing of the airways that happens specifically during or after exercise and leads to those asthma-like symptoms.
So even if someone doesn't have asthma, they can still experience those breathing difficulties during exercise.
That's right. And while the exact mechanisms aren't fully understood, it's thought that changes in airway temperature and humidity during exercise might play a role, triggering that inflammation and bronchospasm.
That's interesting. Are there any other types of asthma related to specific triggers?
There is occupational asthma, which is triggered by exposure to certain substances in the workplace. So things like dust chemicals, fumes, even animal proteins can trigger it.
So it's essentially asthma that develops as a result of your job.
Exactly. It's a form of occupational lung disease and can be quite serious for those who are affected.
That's really important to be aware of.
Yeah.
It highlights how important workplace safety is and making sure that employees are protected from those harmful exposures.
Absolutely. And there's one more type I wanted to mention called cough variant asthma.
What's that?
So, as the name suggests, a persistent cough is the main symptom, often without the typical wheezing or shortness of breath.
So it's kind of a stealthy form of asthma.
Exactly. It can be tricky to diagnose because it doesn't always present with those classic symptoms,
Yeah.
but it's still important to recognize and treat it effectively.
Okay, so we've covered a lot of different types of asthma here. It sounds like it's really important to work with your doctor to figure out what type you have and what your specific triggers are.
Absolutely. That's key to developing an effective treatment plan.
Okay, so let's talk about treatment. What are the main goals when it comes to managing asthma?
Well, the primary goals are to really get your symptoms under control, prevent those asthma attacks from happening, and make sure that asthma doesn't impact your quality of life in the long run.
So it's about both short-term relief and long-term management.
Exactly. And that usually involves a multi-pronged approach. Medications, lifestyle changes, and trigger avoidance are all important components.
Okay, let's start with medications. We talked about a few key classes earlier. Inhaled corticosteroids, bronchodilators, and leukotriene modifiers. How do those fit into the overall treatment plan?
So inhaled corticosteroids are really the foundation of long-term asthma control. They work by reducing that underlying airway inflammation that's really driving those symptoms.
So they're like the first line of defense,
Yeah.
helping to keep the airways calm and less reactive.
Exactly. And then bronchodilators, on the other hand, provide quick relief from symptoms by relaxing that bronchial smooth muscle and opening up the airways.
Right, they're the rescue inhalers. They give you that immediate relief during an asthma attack.
Exactly. And then we have the leukotriene modifiers, which are another option for long-term control. And they block the action of those inflammatory leukotrienes we talked about before.
So it's like having a whole arsenal of medications that target different aspects of asthma.
Exactly. And your doctor will work with you to figure out the best combination and dosages based on your individual needs.
Makes sense. It's definitely not a one-size-fits-all approach.
Right.
Now, you mentioned lifestyle changes. What kind of things can people do to improve their asthma control?
Well, one important factor is maintaining a healthy weight. Obesity has actually been linked to more severe asthma.
So losing weight can actually help improve asthma symptoms.
Yeah, studies have shown that losing weight can significantly improve asthma control, likely by reducing inflammation and improving lung function.
That's great to know. What about exercise? Should people with asthma avoid physical activity altogether?
Not at all. Regular exercise is actually very important, even for those with exercise-induced asthma. It's all about finding activities that you can tolerate and gradually increasing the intensity over time.
So listening to your body and working with your doctor to develop a safe and effective plan.
Exactly. And of course, avoiding smoking and secondhand smoke is crucial. Smoke is a major irritant and can really worsen those asthma symptoms.
Yeah, that goes without saying. Smoke is bad news for everyone's lungs.
For sure.
Okay, what about trigger avoidance? How important is that in managing asthma?
Trigger avoidance is absolutely essential. By identifying and minimizing your exposure to your specific triggers, you can drastically reduce the frequency and severity of your symptoms.
So if you know that pollen is a trigger, you'd want to stay indoors on high pollen days and use air conditioning to filter the air.
Exactly. And if dust mites are a problem, you'd want to use dust mite covers on your mattress and pillows. Wash your bedding frequently and hot water vacuum regularly.
It sounds like trigger avoidance requires some effort and adjustments, but it can make a huge difference in managing asthma.
Absolutely. And for people with allergic asthma, allergy testing can be really helpful in identifying those specific allergens to avoid.
So with the right combination of medications, lifestyle changes, and trigger avoidance, people with asthma can live full and active lives.
Exactly. Asthma doesn't have to hold you back. With proper management, you can achieve good control of your symptoms and maintain a high quality of life.
This has been such an incredibly informative deep dive into the world of allergies and asthma. We've covered so much. The different types, the triggers, the medications, the lifestyle changes, and the importance of working with your doctor to develop a personalized treatment plan.
It really has been a comprehensive exploration, and I hope our listeners feel empowered to take control of their health or support their loved ones who might be struggling with allergies or asthma.
Absolutely. Knowledge is power. The more you understand about these conditions, the better equipped you'll be to manage them effectively. And as always, don't hesitate to reach out to your healthcare providers with any questions or concerns.
Couldn't agree more. We're all in this together. And don't forget to like and subscribe to the channel so you don't miss our next episode. For more exclusive content, check out our Patreon below for details. See you next time.